Hello, Kingdom Warriors. Welcome back to the Growth Lab, where we are growing our mind, our muscles, and we are growing in life, okay? If you are new to the channel, welcome. If you are not new, you already know the vibes, baby. All right, so I'm going to be talking about nursing and specifically like about this last shift that I had. And I'm going to give you some words of wisdom and advice. This is what I've done. And I'm going to save you the time and trouble of not going through it, okay? During the shift, we had a 4-patient list, and we had a lot of different like tasks that we had to do. We had to call people, call ultrasound, call lab. We had to do that, and we had to message the doctor a lot. So this shift, we were messaging the doctor a lot. And one tip that I'm telling you today, if you are a new grad, or if you're just nervous, or if you're scared, or whatever, is that don't be afraid to message the doctors. And this is what I'm going through right now. And I'm trying to tell myself, you know what, these people, these doctors that we're messaging, they're people. At the end of the day, when we clock out and we walk out of this building, we are no title behind us, you know. We do still have the license or whatever, but we are just people at the end of the day. We are human. We make mistakes, you know. We have feelings, whatever. We just have to look at it like that, and not be afraid to ask these questions, because you never know what question you ask and get the answer that could potentially save the patient, you know, from a worsening condition. So I was blowing up this doctor's line, you know, and it's better to ask questions and look dumb or whatever, appear dumb, than to not ask the questions and be dumb because something happened to the patient, their condition is worsening. Yeah, overall, ask those questions. And so that was one. So we got a lot of answers from the doctor, and he was responsive, responds really quick. And that's one piece of advice I would recommend doing. Lesson number 2, if you find yourself being a little bit forgetful during night shift, and it possibly could be because of that experience, brain fog, because my memory is pretty good, you know, and I'm not trying to toot my own horn or anything, but I find my memory is pretty good. But right now, during the night shift, I'm getting a little foggy, and when you have a preceptor that's giving you all, you know, gems of information, and then you got patients, conditions that the IV, you got to take out the IV, you got to switch this antibiotic, all this information is being thrown at you on top of the weird hours that we're working, and on top of the stress, you know, it could be hard to remember stuff. So this is what I've done this past shift, and I found it to be very helpful. I'm going to do it moving forward, is if you are using Epic, there is a little sticky note at the top left corner of the patient's, when you open the patient's chart, click that, and it opens up this yellow sticky note, and you could write all your little notes that you want to save for the patient throughout the shift. And that's very helpful for when you're giving updates to the patient, updates about the patient to your charge nurse or team leader, whatever. And it also helps with giving report too, because then you can see that instead of looking at your paper or trying to remember, you already have it right there, you know, and it just saves everybody's time, and you get out of there quick. So that's piece of advice number 2 that I recommend you trying, if that's something that trying to remember everything is hard for you, you know. And tip number 3, advice number 3, what I would say is really look over the active orders. Look over the active orders and labs before you do the assessments on your patient, your initial assessment. Sorry, I'm tongue-tied right now. Initial assessments on your patients, because you want to know of any critical labs, not critical, well, because they'll call you from lab if it's critical, but any labs that look like they're trending down and you should maybe message the doctor about. You want to do that at the beginning of your shift and not wait until the end of the shift, okay? And I've learned that this past shift because one of our patients, I think their potassium, the potassium was trending high. So their morning labs came towards the end of the shift, and I think it was like 5.2. And so that's going like a little over the normal of 3.5 to 5, you know? So, well, per your hospital, I don't know. So I was like, dang, but it really made me think like I need to not worry about the time so much of being like done at a certain time and worrying about like staying over to chart. Like, forget that, honestly, because that you can catch up on, but like seeing the labs and knowing what to call about, I think is more important. And I would start your shift doing a quick look. But if you have not already done so, I had to learn the hard way, so I'm learning the hard way. But I'm telling you, so you don't have to do that, you know? So look at the labs and look at the orders, okay? And if you have to write down the really like important ones, I would. So then you kind of know like, all right, this is what's going on. If they add another order, they're adding it, or they're discontinuing that order, they're DCing it, you know? So that is tip number 3, piece of advice number 3, to really make sure you kind of hone in on at the beginning of your shift, okay? Piece of advice number 4 is delegation. And I've said that in the other videos before, but I'm saying it again. Delegation is key. It'll save you time, and you're just a team player when you do that, you know? Somebody helps you, you return that favor later, and then it's like, we are just a team, like, we are family, baby, at that point, because this is not a one-man job, one-woman job, whatever. This is a team job, okay? And use as many resources as you can. That's what I'm seeing with every shift that goes by, and I'm starting to like realize is how important that is. And it just saves your life, and it saves the patient's life, you know, because you're not dying and breaking your back, and the quality of care goes up. So when that happens, you know, because you can focus more on the patient or whatever, vice versa. But that's piece of advice number 4, delegation, baby. And then, okay, so 5, the 5th one is time management. And that's across the board. I see that as an issue with new grads, and it's an issue with me because I am a new grad as well. What I've been doing these past couple shifts, and I found that to be helpful, is putting a timer on my Apple Watch and putting it for, because we had to do Q2 observations for the patients every 2 hours. So I put it for every 2 hours, and then it goes off, and then I chart, and I go look at the patients, and then I chart and do whatever med pass I need to do. But that's been helpful too. It keeps me on time with the charting and on time with like just everything else, you know? So if you don't do that already, I would recommend doing it or trying it at least once, twice. See how that works out for you if you're struggling with time management. And also charting too, being behind on charting. You want to set timers, and you want to set a goal too. And that's what I like about my preceptor and my preceptors in the past too, because they always ask me like, what do you want? What is your goal of this shift? Oh, let's have your goal be that you finish your charting, all your charting by 1 a.m., you know? So it's like, set a goal for yourself of how you want to chart. And, you know, I still go over that time. I'm like charting at like 6 o'clock still, but you know, it comes with time that, we get quicker, you know? So, that's something I've also learned. And then 6. The 6th one is, you know, don't let anybody be rude to you. Do not let any person, any doctor, any patient, any coworker be rude to you, because at the end of the day, what you are trying to do is you are trying your best. You are trying your best. This is difficult. This is not easy. And I'm speaking that like of my experience, like it's not easy. it's not no walk in the park what we're doing here and trying to like learn and do on our own, you know? And what makes it harder is if somebody is like a doctor is rude to you, or like whoever is rude to you. So don't let anybody be rude to you. Speak up. If they're rude, pull them aside and be like, hey, I didn't like how you spoke. I didn't like how you spoke to me like that. I would appreciate it if you would pull me aside and whatever, XYZ. You know, just like talk to the person. If it's a real issue, if it's more than that, escalate it via your chain of command. But don't put up with it. Do not put up with it, because the job is already difficult. And it's more difficult because we are new, you know? So stand up for yourself and don't let anybody be rude to you, okay? So those are the 6 key things that I've, you know, learned and seen throughout these shifts, well, throughout this last shift and previous shifts, that I think are very important and very helpful to know and to really hone in on as we continue going through our new grad experience. Okay, so I hope this helped somebody out. If it did, let me know. I'll share more tips and tricks that come to mind when I work my shifts. Okay, so thank you for watching, and I'll see you in the next video.